Project Grab and Go, a proposed nutrition program to enhance the health of elementary school age children. Presented by Trisha, Tara, and Maryann. Mentored by Dr. Audra Gollenberg. In the United States, 50 million individuals are food insecure. 40% of those are adults with children. Food insecure homes spend 45% more annually on medical costs than houses who are not food insecure. In Winchester, Virginia, 56.9% of the population is living in a food desert. So our target for this program is the households in Winchester with elementary students. Our mission is to improve access and education for children and their families by using pre-packaged groceries and a detailed curriculum.
For Project Grab and Go, we have two goals. Our first goal aims to improve access to nutrition by implementing our food box program at the elementary school. Once implemented, this will help facilitate ease of access to nutrient-dense food choices. Families participating in this program will be assessed with a baseline survey in August 2021 to determine pre-program perceptions of nutrition access. By the end of the school year, a minimum of 3 out of 4 families will report an increase in access to nutrient-dense foods. Also, to measure the impact and outcome of this program, 25% of children in the program will show at least a 0.5% decrease in BMI over the course of the school year. Our second goal aims to improve nutritional understanding among participating children and family members through an in-school curriculum that includes meal planning, portion control, and the instillment of self-efficacy through a number of best practice processes. Through preliminary research, we have established that targeting both goals independently have not led to sustainable changes. We are proposing both goals together to implement behavioral and environmental changes that persist in the community beyond the program end date. Project Grab and Go is utilizing social cognitive theory, or SCT, as a framework for establishing goals and objectives, and also for the intervention strategies which aim to reduce food insecure environments within homes. It provides constructs that influence positive feedback mechanisms within the program participants. As humans, our environment and social settings heavily influence our behaviors and cognitive skills, such as logic, reasoning, and perception. In return, behaviors and cognitive skills influence our environments and social settings. SCT is unique in that it focuses on communal and internal reflection and reinforcement to develop sustainable, goal-directed changes in behavior. Changes learned and developed are meant to be maintained beyond the active program period and persist throughout the participant's lifetime. SCT has 5 constructs that we will utilize in the Grab and Go program: self-efficacy, reciprocal determinism, behavioral capability, reinforcements, and observational learning.
Here is the layout for the intervention plan for Project Grab and Go. Before the school year, there will be meetings with stakeholders, school systems, and the recruitment of volunteers. During the first week, surveys will be collected to determine the community's needs and current perceptions on nutrition. Meal kits will be available for pickup at the school, and they will be packaged and handed out by volunteers. The educational component will be delivered in the classrooms throughout the school year by trained professionals. Parents or guardians can sign up for message alerts to keep them in the loop about the educational aspect and send home talking points for families. During the 10th week, the students will take a field trip to a local farm to see fresh fruits and vegetables be grown to understand where the food they are eating is coming from. During the first week, 20th week, and last week of the program, BMI measurements, classroom assessments will take place along with guest speakers visiting. Surveys will be completed by guardians after the program to see if the program has been helpful to build their knowledge and skills on home-cooked meals and whether the program is something they would participate in again. In conclusion, because of the cyclical nature of poverty, it is vital to teach individuals the importance of healthy eating at a young age. When a student observes healthy behaviors, they are more likely to implement them into their own lives. By using SCT as a framework, changes will be made to the environment, social interactions, and cognitive skills. The meal kits will improve their nutritional intake, and the educational aspect will teach them strategies and knowledge to implement for the rest of their lives. Thanks for watching.